Welcome back. We're coming to you from New London Hospital, and today we're talking with their medical director, Dr. James Murphy. Thanks for joining us.
Well, thank you, Lynn, for having us once again.
We talked a little while ago about all the great services at New London Hospital, and now you've got a number of new providers that you've recently just recruited that are coming on so that we can have everything here right under one roof.
I think that's one of the blessings for the folks that live in New London in the surrounding areas, that the providers, the the tertiary care providers are coming to see them, right? Mm-hmm. And this really started, it started many years ago, but it really gained a lot of speed and impetus since the affiliation with Dartmouth 5 years ago as the first Alliance hospital in 2013. Mm-hmm. Having said that, currently we have in the range of somewhere between 17 and 20 what they call PSA, professional service arrangements or agreements, whereby we essentially have providers in various subspecialties coming down from Dartmouth in Lebanon or from Concord or wherever, to New London, spending part of their clinical time here in New London, taking care of our patients. And as a result of that, the patients don't have to now drive up there to see them on a cold winter day, you know, sort of thing. Mm-hmm. And having said that, not only do we have things like general surgery and orthopedics and ENT and GI and pain management, oncology, a lot of different subspecialty services that come here for different times during the week, depending on the need.
Okay.
What we're always trying to do is titrate the demographics, or the need, or I should say, titrate the providers that we have coming down here to the need of the community. Mm-hmm. Having said that, we are I would say the second oldest or second most mature demographic in the state, mm-hmm. including us. Mm-hmm. And as a result of that, we have special needs, or different needs, I should say.
Yes.
And as a result of that, we are bringing on 3 and possibly 4 different service lines to New London Hospital from Dartmouth mm-hmm. in the next 1 to 6 months. So for instance, we're bringing down a Dartmouth urologist that will be finishing his fellowship at the Mass General Hospital this fall. He will spending part of his time at New London, part of his time at Dartmouth. Mm-hmm. We're bringing down a pulmonologist who will help with many of the pulmonary issues that many people, not only just senior folks, but also the pediatric people, but things like COPD and asthma, which will be really nice to have a pulmonologist down here doing that.
Sure.
We're also hiring jointly with Dartmouth a dermatologist. Mm-hmm. And again, oftentimes the folks that we have here are traveling south in the winter. They come back and be exposed to sun, come back with skin issues that need to be addressed. So bringing the specialists here is a tremendous benefit to the community. One that really I think has significance regarding our community is that we are working with the cardiac folks at Dartmouth to bring cardiac rehab down here.
Super.
3 days a week. Now think about it. After you've had a heart attack, the last thing you want to do is have to drive through a winter snowstorm through 89. You know what that can be like.
Well said.
In the middle of winter. I mean, that would give you a heart attack in and of itself.
Right.
So what we're trying to do is bring the cardiac rehab folks down here to help with our patients in their recovery efforts. So I think the marriage of Dartmouth and through the affiliation has been tremendous for this community.
Mm-hmm. And with more providers coming every day, so super.
It seems like it, yeah.
We'll stay tuned to that. You've got a great physician finder right on your website.
Yes,
and that's a good way to keep on top of who's coming.
That's
so
right.
Thanks so much for all you do.
You're welcome, Lynn. Thank you for coming down.